Hello everyone, my name is Jenny Rios. This is my patient presentation for the week 3 of the course Sapien 785. The profile of this patient, she's a female, 60 years old, her height is 61 inches, her weight is 245 pounds, which based on the BMI is 46.3, which is considered a morbid obese. We don't know the usual body weight of this patient, and her ideal body weight is 105 pounds. The chief complaint to be admitted was altered mental status. So right now the primary diagnosis is heart failure, and the secondary diagnosis for this patient is that she has a acute kidney injury, anemia, arrhythmia, diabetes, gallstone, GI bleed, hepatitis, and hypertension. Looking at her labs, the blood pressure is high. The glucose are good, and the potassium, the bone is low. The creatinine is a little bit high. The GFR is super low because she has a problem in the kidneys, and the BMP is super high with 1280. So her current medication and treatment, she's using for treating the diabetes, the Current and Humalog. She also is under Lasix because she presents like a lot of fluid in her body. Keppra, which is an anticonvulsant medication. Protonix, which helps with the production of the acid in the stomach. Colace, which is a stool softener, but it was hell. Um, and Sofran for nausea and vomiting, and Ambien because the patient mentioned that she couldn't sleep for 3 days. So identifying the nutrition problem that the dietitian is responsible for treating, we'll say monitor her weight because the patient, as we remember, the BMI was super high. She was under obese, morbid, and also I recommend to check the lipid panel because she was high on the BMP, which is the brain natriuretic peptide, and the BMP test measures the level of BMP in the blood. It is typical use for diagnosing heart failure, and it has to be monitored because we want to prevent any heart problem and also increase the risk of any cardiovascular events. So my nutrition assessment includes calculate the estimated needs, which I put the 15 to 20 kilocalories per day, and the protein zero point 0.8 to 1 because she also has diabetes, as we remember in the past history, and the fluids I will say 20 to 25 because she had like a lot of fluid in her stomach, and also I put per MD the recommendation of the fluids for the nephrologist because I think she is having a little problem with the kidneys too. So the nutrition focused physical exam, I put the malnutrition, it wasn't present in the food and nutrient intake. She didn't present any weight loss, no loss of subcutaneous fat, loss of muscle. The only thing I put that is not present the fluid accumulation. However, I found in the chart that she had ascites, which is the accumulation on in her stomach. But when I visit her, she was already okay. So the root grip strength, I wasn't able to do it. And the PIS statement, I put altered nutrition, high food intake related to cardiac labs as evidenced by a high BMP and acids. So the intervention that I did for this patient is I recommend a diet, which is the cardiac CHO 60-gram diet because she has a high BMP and also she has diabetes. Check the lipid panel again. Make sure that everything is okay, which I don't think so. Nutrition monitoring evaluation, monitor per oral intake, weight, and labs. So her current meal intake is good, which is 75 to 100%. I also asked her how she was feeling with the current diet, and she also mentioned that she was feeling okay, and she don't even feel like any hunger or anything at the moment. So I will continue with this diet, and I keep an eye on her. So this is going to be the end of this patient presentation, and thank you so much. I will see you next week. Thank you. Bye.